The 13 best foods to lower cholesterol. Having high cholesterol levels is considered a significant risk factor for heart disease. Having excess LDL, often known as bad cholesterol, in your bloodstream may increase your risk of heart disease by contributing to atherosclerosis, or the formation of plaque in your arteries. To reduce your heart disease risk, it's essential to maintain healthy cholesterol levels. Fortunately, making dietary changes, such as increasing your intake of heart-healthy fruits, vegetables, nuts, and legumes, can help you achieve and maintain optimal cholesterol levels. Here are 13 of the best foods to lower cholesterol. 8. Oats and oat bran. Studies show that eating oats regularly can significantly reduce heart disease risk factors, including high total and LDL cholesterol levels. Oats and oat bran are concentrated sources of a soluble fiber called beta-glucan, which helps lower cholesterol by preventing the absorption of cholesterol in the GI tract and increasing cholesterol excretion through the stool. A 2022 review that included 13 studies found that the consumption of dietary oat beta-glucan was associated with significantly lower total and LDL cholesterol levels in people with high cholesterol. Though almonds, nuts and seeds are a rich source of soluble fiber and can help reduce cholesterol levels when consumed as part of a nutritious diet. Almonds are a popular type of nut that has been consistently linked with heart health benefits, including reduced cholesterol levels. Numerous studies have shown that incorporating almonds into your diet is an easy and effective way to improve and protect heart health. A 2023 review of 19 studies found that the consumption of nuts, including almonds, is effective for decreasing total cholesterol, LDL cholesterol, and triglyceride levels, which can help boost heart health. The review also found that people who regularly consume nuts have lower levels of small dense LDL particles, which are more strongly linked to atherosclerosis development than larger LDL particles. 10. Berries. Berries, such as blueberries, strawberries, cranberries, raspberries, and blackberries, are excellent sources of fiber and other heart-protective nutrients and plant compounds such as anti-inflammatory flavonoid antioxidants. Adding berries to your diet could benefit heart health in several ways, including lowering LDL cholesterol, boosting heart-protective HDL cholesterol, and lowering blood pressure levels. A 2018 review found that berry intake was linked to reductions in total cholesterol, LDL cholesterol, triglycerides, and blood pressure, as well as improvements in levels of HDL cholesterol. In addition to lowering cholesterol levels, berries may help protect against heart disease by reducing inflammation, improving artery function, and protecting against cellular damage. 4. Walnuts. Like almonds, walnuts are an excellent source of soluble fiber, which is effective for reducing cholesterol levels. A 2022 review that included 13 studies from the US, Europe, and Asia found that walnut intake was associated with significant reductions in total cholesterol, LDL cholesterol, and triglyceride levels, especially in people considered overweight and obese. In addition to fiber, walnuts contain polyunsaturated fatty acids, PUFA, including alpha-linoleic acids, which activate LDL receptors that help remove excess LDL from the blood. 5. Beans. Beans are one of the best choices for lowering cholesterol levels. Beans are an excellent source of fiber, which binds to cholesterol and prevents it from being absorbed into the bloodstream. In fact, research shows that eating about 3/4 of a cup of beans may reduce LDL cholesterol levels by 19% and lower heart disease rates by 11%. 6. Avocados. Avocados have been linked to several impressive benefits, including improving heart disease risk factors like high LDL cholesterol and low HDL cholesterol. Studies show that eating avocados regularly may help increase heart-protective HDL cholesterol and decrease levels of oxidized LDL cholesterol, a type of cholesterol that's significantly associated with atherosclerosis. 7. Flax seeds. Flax seeds are a good source of heart health promoting nutrients, including soluble fiber and magnesium. Adding flax seeds to your diet could help lower total and LDL cholesterol levels, thus supporting the health of your heart. A 2020 review of 62 studies demonstrated that flaxseed supplementation significantly reduced total cholesterol by an average of 5.389 mg per deciliter and LDL cholesterol by an average of -4.206 mg per deciliter, which could delay the progression of heart disease. At cocoa products. Though eating sweets like chocolate candies too often can harm the health of your heart, adding certain cocoa products to your diet, like unsweetened cocoa and cacao nibs, may help promote heart health by improving blood lipid levels, lowering inflammation, and supporting healthy blood pressure levels. Studies show that cocoa and dark chocolate intake may help increase heart protective HDL cholesterol levels and significantly decrease LDL cholesterol. Also, unsweetened cocoa products have also been shown to improve blood vessel function and blood flow, which can protect against heart disease risk. No. Chia seeds. Chia seeds are tiny seeds that are packed with nutrients, including fiber and healthy fats like PUFAS. Chias are one of the best sources of fiber you can eat. In fact, the fiber content of chia seeds exceeds dried fruit, cereals, and nuts. Because they're so rich in fiber, and other lipid-lowering nutrients like fatty acids, chia seeds are a good choice for those with high cholesterol. Studies show that eating chia seeds helps reduce total and LDL cholesterol levels in people with elevated blood lipid levels. Plus, chia seeds can help boost HDL cholesterol. Thus, okra. Okra is a highly nutritious vegetable that contains compounds called polysaccharides, which have lipid-lowering properties. Okra is also a good source of fiber, which is highly effective for lowering cholesterol levels. A 2020 study found that 8 weeks of okra powder consumption resulted in a significant decrease in total cholesterol and LDL cholesterol as well as fasting blood sugar in people with type 2 diabetes. 11. Apples. Apples are a popular fruit that can benefit your health in several ways, including reducing high cholesterol levels. Because they're rich in fiber, including soluble fiber, eating apples is a smart way to promote healthy blood lipid levels and keep your heart healthy. A 2020 review concluded that whole apple consumption is an effective way to reduce total cholesterol and LDL cholesterol, as well as systolic blood pressure and inflammatory markers. The researchers recommended a daily intake of 100 to 150 grams a day of whole apples to reduce heart disease risk, which equates to one small to medium-sized apple. 12. Buckwheat. Buckwheat is a naturally gluten-free pseudo-grain that's high in lipid-lowering nutrients, like fiber, flavonoids, and bioactive peptides. Choosing buckwheat over refined grain products, like white rice and white bread, could help you lower your blood lipid levels, including total cholesterol and triglyceride levels, and could also help improve your nutrient intake, as buckwheat is rich in vitamins and minerals like magnesium and potassium. 13. Seafood. Studies show that people who eat fish more regularly tend to have healthier blood lipid levels, including higher levels of HDL cholesterol and lower levels of VLDL cholesterol, which could help protect against heart disease. Fish, especially fatty fish like sardines, trout, and salmon, is an excellent source of anti-inflammatory omega-3 fats, which are known to support healthy blood vessel function, plus vitamins and minerals like zinc, calcium, and selenium, making fish a good choice for overall health. Foods to limit. There are many factors that can contribute to high cholesterol levels, including your dietary choices. Though your diet as a whole is what matters most for heart health, limiting the following foods is wise if you have elevated blood lipid levels. Ultra-processed foods such as frozen foods, packaged snack foods, and fast food. Added sugar, sugary drinks, and sweets like ice cream, cookies, candy, and cakes. Fried and greasy foods such as fast food, fried chicken, and French fries. Alcohol such as beer, wine, and liquor. While limiting these foods can help reduce your blood lipid levels, it's important to replace these items with nutrient-dense foods known to support heart health, like vegetables, fruits, beans, nuts, and seeds. Other ways to lower cholesterol. In addition to following a well-rounded, nutritious diet, a healthy lifestyle that includes plenty of exercise, quality sleep, and stress management can help support overall heart health and optimal blood lipid levels. Staying physically active, getting at least 7 hours of sleep per night, limiting alcohol, quitting smoking, and maintaining a healthy body weight are all essential for managing cholesterol levels. It's also important to understand that some people are genetically predisposed to have high cholesterol levels, which is known as familial hypercholesterolemia. People with familial hypercholesterolemia have a reduced capacity to remove excess LDL from their bloodstream and may require medical management in order to reduce their risk of heart disease. If you have familial hypercholesterolemia, your healthcare provider will recommend the best treatment based on your specific health needs. A quick review. If you have elevated cholesterol levels, there are plenty of ways to reduce your cholesterol while promoting overall heart health. Following a diet rich in foods known to lower cholesterol levels, like oats, berries, beans, nuts, and seeds, is one of the best ways to support healthy blood lipid levels and reduce your heart disease risk. If you're concerned about your cholesterol levels or need specific dietary recommendations for reducing cholesterol, speak with a trusted healthcare provider like a cardiologist or a registered dietitian who specializes in heart health. How is high cholesterol treated? Cholesterol is a waxy substance that your liver produces and is found in your blood. Your body uses cholesterol to make vitamin D, hormones, and other substances to help you digest food. While your body makes all the cholesterol that it needs, you can get added cholesterol from animal sources like meat and dairy products. As a result of eating too much of these foods, you may be at an increased risk of developing high cholesterol. Having too much cholesterol in your body can block blood flow, making you more likely to experience serious medical complications such as stroke or heart attack. That's why knowing how to lower your cholesterol if you have high cholesterol is so important. Generally, you can treat high cholesterol with lifestyle changes like an improved diet and an increase in physical activity. However, if lifestyle adjustments aren't helping you get your desired results, your healthcare provider may suggest certain medications to bring your cholesterol levels to a healthy range. Adjusting diet. If you have high cholesterol, your healthcare provider will likely talk to you about your eating habits and meal plans. To help bring your cholesterol down, your provider will usually discuss changing your diet. In some cases, they may also refer you to a nutritionist who may help you develop an eating plan that's right for you. A diet best suited for reducing cholesterol consists of fruits, vegetables, fish, beans, lean meats, whole grains. Your healthcare provider may also recommend refraining from sweets and desserts, fatty meats, foods high in salt and fats, alcohol. The DASH diet may be a good place to start when making dietary changes. DASH is an acronym that stands for Dietary Approaches to Stop Hypertension, High Blood Pressure. This diet focuses on eating foods that are high in potassium, protein, calcium, and fiber while low in salts and saturated fats. A review of the DASH diet was published in the British Journal of Nutrition in 2015, which studied the effects this diet has on heart disease. Researchers found evidence that the DASH diet may lower blood pressure and cholesterol. While diets aren't one size fits all, talk to your healthcare provider about the DASH diet and whether this eating plan may work for you. Exercising. A lack of physical activity can increase your risk of having high cholesterol. If you have high cholesterol, moving your body more frequently can help bring your levels to a healthy range. According to the American Heart Association, adults should get at least 150 minutes of moderate-intensity aerobic exercise weekly. Your healthcare provider may recommend the following activities: walking or running, hiking, biking, swimming, dancing, yoga. Keep in mind, the above activities are not an exhaustive list of exercises you can complete. The important thing is to find a combination of activities that you enjoy doing and help keep your body active throughout the week. Managing weight. Obesity increases your likelihood of having high cholesterol. To reduce your cholesterol levels and reduce the risk of complications, your healthcare provider may recommend managing your weight if you are obese. In most cases, they'll help you achieve any desired or recommended weight loss with dietary changes and an exercise program. Your provider may also recommend stress management techniques to help boost your emotional well-being and help you become more mindful about your food and exercise choices, which may help you lose weight and keep the weight off. These techniques may include meditation, deep breathing, and journaling, among others. Reducing stress. One study published in Medicine in 2017 found that psychological stress was associated with higher LDL, or bad, cholesterol and lower HDL, or good, cholesterol. That said, identifying your stressor and learning how to manage them may help reduce high cholesterol levels. The American Heart Association has several recommendations for stress management. Some of these strategies include positive self-talk, such as, "I'll do the best I can," or, "I know how to handle challenges." Mindfulness and meditation. Counting to 10 during a stressful situation. Taking a walk in nature. Doing yoga. While stress is a part of daily life, having too much stress or feeling unable to manage stressor properly can lower your quality of life and hinder your emotional wellness. In such cases, you may find it helpful to talk to a mental health professional for therapy and added support. While you can find a therapist on your own, you may also consider asking your primary care provider for a referral. Avoiding substance use. Research suggests that quitting smoking can raise your HDL cholesterol. HDL, or good cholesterol, helps reduce LDL, or bad cholesterol, from your arteries, or blood vessels that transport oxygen and nutrients to your organs and tissues. Additionally, drinking too much alcohol can lead to weight gain, which can increase your LDL cholesterol and lower your HDL cholesterol. Healthcare providers recommend that people assigned male at birth should have no more than 2 alcoholic drinks, while those assigned female at birth shouldn't consume more than 1 drink. Taking medications. Your healthcare provider may suggest cholesterol-lowering medications if lifestyle changes are not enough to help reduce high cholesterol levels. Based on your cholesterol level and overall health, your provider can prescribe one of the following medications. Statins prevents the liver from making cholesterol and helps lower LDL cholesterol while raising HDL cholesterol. Statin medications are usually safe to use. However, you may experience certain side effects such as muscle weakness, trouble thinking, and an increase in blood sugar. If you have a history of liver disease or are pregnant, your provider will likely not prescribe you statins. Bile acid sequestrants blocks bile acid from being absorbed into the bloodstream. This can help to lower LDL cholesterol. Common side effects can include constipation, indigestion, and increased burping. Cholesterol absorption inhibitors inhibits cholesterol from being absorbed in the intestines, which can help reduce high cholesterol in your body. You might experience side effects such as diarrhea and joint pain. However, these medications may not be safe for people who are pregnant or breastfeeding. Niacin, nicotinic acid, niacin, also known as vitamin, helps lower LDL cholesterol and boost HDL cholesterol. You can purchase this medication over the counter, but it's best to consult your healthcare provider before taking the vitamin. Niacin can cause side effects such as cough, skin rash or itching, and an upset stomach. If you have diabetes, proceed with caution before taking this medication as this can also raise your blood sugar. PCSK9 inhibitors. PCSK9 inhibitors block the action of a protein called PCSK9. This protein found in the liver helps to remove LDL cholesterol from your bloodstream. Side effects can include flu-like symptoms, back pain, and difficulty breathing. Living with and managing high cholesterol. If you learn you have high cholesterol, your healthcare provider can help you develop a treatment plan that is right for you. This may include a breadth of options including dietary changes, an exercise program, stress reduction techniques, and medications. According to the American Heart Association, your primary care provider may also suggest medications for lowering cholesterol if you have a history of heart disease or stroke. Live with diabetes. Are 40 to 75 years old and have an LDL cholesterol level of 70 to 189 mg per deciliter. What's important to know is that being proactive about your cholesterol levels early can help bring them back down to a healthy range. This can reduce your risk of health complications such as heart attack or stroke, and lower your likelihood of developing other health conditions. So don't wait until it's too late, and talk to your healthcare provider about what you can do to lower your cholesterol and improve your long-term quality of life. A quick review. High cholesterol occurs when your body has more cholesterol than it needs to function properly. You may be at an increased risk of developing high cholesterol if you eat a high salt and high fat diet, live a sedentary lifestyle, and use substances. The good news, you can bring your cholesterol levels back down to a healthy range with a variety of lifestyle changes and medication. What is high blood pressure? High blood pressure, or hypertension, refers to blood pressure that is consistently higher than the standard normal level. For adults, normal blood pressure is below 120/80 mm of mercury. You may have hypertension if your systolic blood pressure, the first number in a blood pressure reading, is regularly above 130 mm of mercury, or if your diastolic blood pressure, the second number, is consistently above 80 mm of mercury. Around 47% of adults in the US have high blood pressure or are taking medication for high blood pressure. If left untreated, hypertension can increase your risk of a number of health complications over time, including heart disease and stroke. High blood pressure symptoms. People with high blood pressure typically don't experience any signs or symptoms. You can have hypertension for years without knowing. Most people find out they have high blood pressure after they get it measured, whether by a healthcare provider or through an at-home test. However, you can experience symptoms during a hypertensive crisis, which is when your blood pressure spikes to 180/120 of a millimeter of mercury or over. Symptoms associated with a hypertensive crisis may include nosebleed, severe anxiety or a feeling of impending doom, shortness of breath, sudden headache. A hypertensive crisis is a medical emergency. Call emergency or go to the hospital immediately if you experience any of the symptoms above alongside a blood pressure reading of 180/120ths of a millimeter of mercury or more. What causes high blood pressure? Blood pressure measures the amount of force used to pump blood through your arteries. Systolic blood pressure measures that force at the moment your heart beats. Diastolic blood pressure measures the amount of force between beats. Over time, your systolic or diastolic blood pressure may go up if your heart has to work harder and use more force to pump blood to the rest of your body. Many genetic and lifestyle factors can contribute to the development of high blood pressure. For instance, having a family history of high blood pressure can increase your risk of having the condition. Other risk factors for developing high blood pressure include eating a diet very high in salt, not getting enough of certain minerals in your diet, such as magnesium and potassium, having anxiety and stress, having insomnia, lack of sleep, living a low-activity lifestyle, drinking alcohol excessively, being 55 years or older. How is high blood pressure diagnosed? A healthcare provider can diagnose you with high blood pressure by measuring your blood pressure levels. Typically, they will measure your levels by placing an inflatable cuff on your arm and using a gauge to measure your systolic and diastolic blood pressure, along with your pulse. Your provider may repeat the measurements several times in one visit or over the course of several visits to make sure that the readings are accurate. If you are at risk for developing hypertension, your healthcare provider may ask you to take your blood pressure regularly at home using a digital blood pressure monitor. Stages of high blood pressure. There are 4 stages of high blood pressure. Elevated blood pressure, 129 mm of mercury systolic and less than 80 mm of mercury diastolic. At this stage, you are likely to develop high blood pressure and should take steps to lower your blood pressure and prevent it from getting higher. Hypertension stage 1, 139 mm of mercury systolic and 80 to 89 mm of mercury diastolic. At this stage, your blood pressure is considered high and your healthcare provider may recommend lifestyle changes and possibly medication to lower your blood pressure. Hypertension stage 2, 140/90ths of a millimeter of mercury or higher. At this stage, your blood pressure is considered very high and your healthcare provider may recommend both lifestyle changes and medication to lower your blood pressure. Hypertensive crisis, 180/120ths of a millimeter of mercury or higher. This stage is considered a medical emergency and will require immediate care. Treatments for high blood pressure. If you have high blood pressure, your healthcare provider may recommend lifestyle modifications, medications, or both to lower and then manage your blood pressure. Certain lifestyle changes may help you manage high blood pressure and prevent related health complications, including avoiding sugary snacks and beverages and lowering your sodium intake to 2,300 mg a day or less, preferably 1,500 mg or less. Eating a diet rich in fruits, vegetables, low-fat dairy, whole grains, nuts, and legumes. Reducing your intake of saturated and trans fats. Limiting your intake of red meat and choosing leaner cuts when you do eat it. Keeping your alcohol intake within the recommended daily limit. 1 drink for women, 2 for men. Exercising at least 30 minutes, 5 days. Reducing your stress levels and seeking treatment for anxiety if needed. Talk to your healthcare provider about which of these changes are right for you. Together, you can create a plan to implement some of these modifications. Sometimes, lifestyle changes alone are not enough to effectively manage high blood pressure. In these cases, your healthcare provider may prescribe one of the following medications: angiotensin-converting enzyme (ACE) inhibitors, angiotensin II receptor blockers (ARBs), beta blockers, calcium channel blockers. If your healthcare provider prescribes medication to lower your blood pressure, it's important to follow the dosing instructions closely and to take the medication exactly as prescribed. Potential side effects vary by medication but may include dizziness, headache, rash, and fatigue. Talk to your provider if you experience any side effects. For many people, hypertension is preventable. Several of the same lifestyle changes used to lower high blood pressure can be used to prevent it in the first place. To prevent hypertension, you can exercise regularly, eat plenty of fruits and vegetables, eat foods high in protein, fiber, and potassium. Lower saturated fat intake. Limit alcohol intake. Related conditions for high blood pressure. High blood pressure typically doesn't cause problems right away. However, it can lead to a number of serious health complications over time. These include heart problems, heart attack, heart disease, angina, chest pain, and heart failure are some conditions you can develop. High blood pressure can damage the arteries and put added stress on the heart, which can impact blood flow to and from the heart. Stroke. High blood pressure can impact the supply of blood and oxygen to the brain. Vision loss. High blood pressure can impact blood vessels, including those in the eyes. Kidney disease and kidney failure. High blood pressure can damage the arteries around the kidneys, which can impact how well the kidneys can filter blood. Sexual problems. High blood pressure can reduce blood flow to the genitals, which could cause erectile dysfunction in men and low libido in women. High cholesterol. High blood pressure can damage the arteries and blood vessels, allowing low-density lipoprotein, LDL, cholesterol to build up in small tears of the arteries. Insulin resistance. High blood pressure is a risk factor for developing metabolic syndrome, also known as insulin resistance syndrome. Living with high blood pressure. Many people live with high blood pressure without knowing it since the condition has almost no symptoms. However, when left untreated, high blood pressure can lead to several life-threatening conditions, such as heart disease and stroke, two leading causes of death in the US. Fortunately, high blood pressure is treatable. It's important to have your blood pressure checked by a healthcare provider regularly so you can be aware of your levels. If you have high blood pressure, you can also get an at-home test to check your blood pressure levels on your own. Hypertension can often be managed with lifestyle changes, such as eating a diet low in salt and getting 150 minutes of exercise. In some cases, your healthcare provider can also prescribe a medication to help lower and manage your blood pressure.